Okay, the last chapter of this book and this course is climate change and the right to health. Obviously, I'm not an expert on this, but I'm going to just go through the chapter. The right to health analytical framework is proposed to be based on these 5 steps. Identification of the relevant national and international human rights laws, norms, and standards. The right to health is subject to resource availability, of course, but states are obliged to progressively realize the right over time and must identify indicators and benchmarks to measure progress. So you cannot use lack of resources as an excuse to forever deny right to health. States have obligations of immediate effect. We will see that in a minute as well. Basically, there are emergencies like, let's say, a disease outbreak, malaria season, or critical care, and so on. They have to have immediate effect. The right to health includes freedoms and entitlements, so you have a right to expect emergency care, for example, and freedom to seek information on what disease you may be facing when there is a certain outbreak, and so on, what risks you may be facing, etc. All health services, goods, and facilities shall be available, accessible, acceptable, and of good quality. Well, this is relative because even within a state or within a city, neighborhood level quality of services, goods, and facilities will obviously be different. States have duties to respect, protect, and fulfill the right to health because of their crucial importance. The analytical framework demands that special attention is given to issues of non-discrimination, equality, and vulnerability. Right? We have been talking about mapping vulnerability, but that should translate to right to health in terms of special attention being given to the most vulnerable, whether it's by age, by socioeconomics, or other factors. The right to health requires that there is an opportunity for the active and informed participation of individuals and communities in decision making that affects their health. This is a co-production, as we talked about before, but right to health has to incorporate that as a fundamental component of the framework. Developing countries have a responsibility to seek international assistance and cooperation, while resource-rich states have responsibilities towards realization of the right to health in developing countries. With globalization, this is now becoming almost a obligation in terms of protecting their own health, because when you have migration and importing farm workers, other workers coming in, you want to be sure that they are also healthy, and this is also working in case of COVID vaccination, for example. As long as the whole world has reached some level of herd immunity through vaccination, let's say, nobody is going to be safe, especially with all the travel that goes on. Hence, rich countries have the obligation to try to vaccinate the developing world. Monitoring and accountability mechanisms that are transparent, effective, and accessible and include redress are crucial. So there must be a way to accountability of mechanisms where poor people can seek compensation in case they are hurt by lack of access or effectiveness of health care. So the right to health itself as a concept goes back to 1948 under the UN. It was defined under the broader human rights mandate and includes these key aspects of the right to health. The right to health is an inclusive right. We frequently associate the right to health with access to healthcare and building of hospital. This is correct, but the right to health extends obviously further. It includes a wide range of factors that can help us lead a healthy life. The Committee on Economic, Social, and Cultural Rights the body responsible for monitoring the International Covenant on Economic, Social and Cultural Rights, calls these the underlying determinants of health. They include safe drinking water, adequate sanitation, safe food, adequate nutrition and housing, healthy working and environmental conditions, health-related education and information, and gender equality. These are now also part of the so-called Sustainable Development Goals, or SDGs, which are a continuation of the Millennium goals, I think, before the start of the 21st century. Now they're called Sustainable Development Goals, so all these things map onto those as well. The right to health contains freedoms. These freedoms include the right to be free from non-consensual medical treatment, such as medical experiments and research or forced sterilization, and to be free from torture and other cruel, inhuman and degrading treatment or punishment. Okay, this gets complicated because of cultural mores and cultural practices that are involved, which are non-consensual, imposed by parents on children, for example. So they get complicated in terms of how to deal with those kind of impositions or culturally forced treatments. Could be degrading or even punishment. Right to health contains entitlements. These entitlements include the right to a system of health protection providing equality of opportunity for everyone to enjoy the highest attainable level of health, the right to prevention, treatment and control of diseases, access to essential medicines, maternal, child and reproductive health. This also comes under Sustainable Development Goal overall in terms of child and women's health, children's and women's health. Equal and timely access to basic health services, the provision of health-related education and information, participation of the population in health-related decision-making at the national and community levels. Health services, goods and facilities must be provided to all without any discrimination. Part of the right to health. Non-discrimination is a key principle in human rights and is crucial to the enjoyment of the right to the highest attainable standard of health. Okay. Additionally, maybe I should stop this, but maybe let's just conclude. All services, goods and facilities must be available, accessible and acceptable and of good quality. So that includes functioning of public health and healthcare facilities. Goods and services must be available in sufficient quantity within a state. They must be accessible physically, as well as financially, and on the basis of non-discrimination. Accessibility also implies the right to seek, receive and impart health-related information in an accessible format. So information is often power. So you cannot deprive people of information. The facilities, goods and services should also respect medical ethics and be gender sensitive and culturally appropriate. In other words, they should be medically and culturally acceptable. Finally, they must be scientifically and medically appropriate and of good quality. This requires, in particular, trained health professionals, scientifically approved and unexpired drugs, and hospital equipment, adequate sanitation, and safe drinking water. Okay, so we'll come back and look at some additional points. We have talked throughout the course about climate change impacts and direct and indirect impacts on health. Here we are talking about climate change and right to health. Okay, so we'll continue the discussion in the podcast coming up, which will be the last one for this course.